I'm intrigued by that first question for patients because you're using language that I use. For example, mission. I actually see myself, my soul here has a mission. How do people respond? Why do you ask that question for one, and the range of answers that you receive?
I ask that question because I think it's a good entree into the idea of the soul that we all have. We all have a soul. All have a yearning for transcendence. That's what makes us human beings. And so I like, I believe that for a healthy life, and it's talked about by Stephen Covey in the Seven Habits of Highly Effective People, that it starts inside then outside. And he always says, begin with the end in mind is one of those habits. And so if you have a purpose, if you know why you're here on planet Earth, then you want every moment of your life to be connected to what that purpose is. Directly, maybe indirectly, you need times of rest and relaxation, but that rest and relaxation is for the purpose of connecting with the purpose of connecting with what you ultimately want to do. The responses I get are interesting. Wow, that's a really good question. I never really thought about that before. I don't know what my purpose is. Maybe, Dr. Gooderson, you can help me. Some people say to be happy. Of course, then I ask them, what does that mean? What does being happy mean? Some people say, to help people. So I get a range of responses, but most of the time people actually do say, I never really thought about that. And it amazes me. They wake up every morning and what are they thinking about? And
It's
it
it's
totally
interesting
amazes me.
because that exact question is what consumes my mind. So the fact that somebody may not be thinking about that is certainly curious to me. I guess I'm want to understand more about how you may conceptualize human distress and despair, because I am a lot of times what's going to drive somebody into seeing a mental health professional is their own internal struggle with some suffering or despair in their life. Do you view that as somebody is off their path, their soul is off their uh, what they're designed to come here for, like their own mission, their own purpose?
I don't view it that way at all. I view the suffering and despair as part of the journey. As M. Scott Peck says in The Road Less Traveled, it starts with life is difficult, and to recognize the inherent difficulties of life, that life is filled with challenges and difficulties, that's part and parcel of what life is all about. And it's how we meet those difficulties that makes all the difference. It's all in our outlook, the attitude, which again is what Viktor Frankl says. It's how our attitude is in terms of how we meet those things. So yeah, difficulties to think, let me go back to the good old days, to think like, when everything was golden. Well, it wasn't probably all that golden anyway, first of all. And secondly, the whole point of suffering and despair, not the whole point, because obviously there's tremendous suffering, which totally consumes people. But the point of any kind of difficulties in life is to grow from it, to learn from it. I say to my patients, this is an opportunity. Look at this as an opportunity. Don't fall into victimhood. Don't fall into woe is me. Look at this. This is an opportunity for me. And let's explore what the opportunities are here. So yes, they come in with despair. They come in with, doctor, I'm depressed. Doctor, give me Prozac. Doctor, I'm having panic attacks, all these kinds of things. And so we begin to look at it. I don't start going into like you mentioned, a checklist of symptoms. You have shortness of breath. Do you have, palpitations? How's your sleep? How's your appetite? I mean, all those things are important to explore, but that's not the first place I'm going to go. I want to get to know them as a human being, ask about their background. So
So if
despair is what we go through.
so if despair is normal and life is about suffering, and that's part of our curriculum,
Mm-hmm.
and how we respond to the challenges that exist in our life are really consequential in our own growth. What do you think about the psychiatric system that tries to classify all the various ways in which somebody responds to internal distress and despair whether that's substance abuse, depression, fear, anxiety, obsessive compulsive disorder, the way they experience their own mood. How do you view the DSM classification system then that tries to reduce it to this idea that they are mentally ill?
I don't pay that much attention to it, to be honest. I am aware of it. I'm not aware of every single diagnosis. I think it's ridiculous that they've sort of brought human life down to, I don't know how many, maybe you know the number of diagnoses that are in the DSM. I mean, it's just amazing to me. So, yeah, we are not, we are so complex. There's so many things involved in what makes a human being a human being. So to bring it down to these sort of particular symptoms all the time and simply to look at it from that perspective is not enough. You need to look at the whole person.